Hi, and welcome to Home Care This Week. We have people that come and talk to us asking advice and asking questions about a whole range of issues when they have a loved one or someone at home that needs assistance with any activities of daily living. But one of the most challenging, and one that people often, while they don't want to ask about it, know it's really important and it's something that they've got to deal with, and that is incontinence. Incontinence in seniors and anyone can be very challenging, but it's a health issue and it can't be ignored. It's a daily fact of life for a lot of people that have trouble just getting around and have trouble just in general with their health, that this becomes an issue. And when people are having to deal with this with a family member or a loved one or someone in their home, it's one that's important to be addressed. And the strategies and skills and so on that are required to help that person often aren't trained, aren't the kind of thing that you would normally just pick up in normal everyday experience. I sat down and talked with a couple of my case managers, Deborah LeBlanc and Natalie Tate, about a lot of the things that they see and some of the things that they go through to try to help people with this situation of incontinence with a senior and a loved one at home. And here's a couple of things that they had to say.
Incontinence, you're going to have to train yourself. You're going to have to take them in there. You're going to have to clean them. You're going to have to wipe them, depending on how bad the incontinence is. If
it could be a big deal.
You should have wipes in the home, gloves in the home, and at least make your bathroom where if they do, like with I just can be personal about it. With my grandmother, our bathroom has the shower right there. So if there's a major accident to where it's everywhere, we can get her undressed, we can get her safely into the shower, get her cleaned up, and get her back out. And that's how we do it.
These are important things to think about. You need an elevated toilet seat.
Yes.
You need grab bars.
Yep.
You need an extendable shower on a handle that you can, clean up everything.
You need the bench or the chair with the handles in there where they feel more secure. My grandmother actually doesn't like the bench. She feels more secure in the little one with the two handles.
She's able to hold herself.
Secure there. So
and many of these people are trying to bring their walkers into the bathroom. They've got their canes. You can't even believe some of the things.
That's why you need to make sure you got a shower big enough to get in and without the huge lift. Ours barely has this much. Grandma doesn't have to step up.
With incontinence, you have to have skin care. You should probably use what they deem in the hospital as a chuck. It's usually a blue cover. You need wet-proof material. You need disposable items. Your local, even your local drugstores, even your larger chains, Costco, Sam's Club, they have all of these cases of diapers and chucks and wipes. A lot of these items cannot be flushed. People, even though a lot of people are still able to get up and use the restroom, it's still maybe they didn't make it or they have, bladder or bowel issues. It's a lot of cleanup. You would be amazed that some people have decided to put area rugs next to people's beds so that anything that's coming possibly off the bed, a lot of clients, because of the medication that they may be on, they'll go to stand up, they might be dizzy, they'll step off of the bed, and then they cannot hold their bladder. And this is men and women. It's no shame, it just happens to be how the body functions. But you do have to have a plan. If you don't have this, now you're calling in a carpet person or trying with a spot bot to clean it up the best you can. There's a lot to helping someone when they're incontinent.
I would also suggest that you have the rubber mats on your beds, because a lot of times this happens during the nighttime.
Right.
Even just the rubber mats on the floor next to the bed are a little bit easier. They're just more wipeable than having to take the carpet if they have an accident, clean it and all that stuff. Always, checking, and especially if there is an incontinence problem in the bowel area, you really need to be sensitive to their skin needs because it is acidic and it tends to burn, and if you're not on it right away, you can have some other issues with the skin as well.
I know, I know who you are, but I know in your background, there are products that they can go out and purchase when their skin is, if it's red, it's already almost too late. It's already starting.
Right.
So you have to stop this process. I know a lot of people use squirt bottles. You can use them with water. I know people are using hot pots. So they literally keep warm water available. They also use the baby warmers. You'd be amazed to go into some of these homes and they've got the baby wipe warmer.
Right.
And it's so that, it's not uncomfortable for this 80-year-old person. The other thing, and I think that our society doesn't do enough, there are YouTube videos out there to show you how you can effectively help someone in the home if you don't have a way to bring in a skilled caregiver. There's also organizations that offer training in some of these arenas where they can go somewhere and be taught how to do some of the tasks that are going to be necessary to keep your loved one at home.
Exactly.